On behalf of the American Academy of Neurology and in collaboration with Neurology Today, it gives me great pleasure to introduce Dr. Rachel Salas. Rachel is an associate professor of neurology and clerkship director at Johns Hopkins University. She's also a graduate, an alumnus, a proud alumnus of our AAN Transforming Leaders program, as well as the Diversity Leadership program. And she's a recipient of multiple awards, the 2015 AAN Clerkship Director Innovation Award, the 2018 AAN Clerkship Director Award itself. And she also currently serves on the Medical Student Diversity and Undergraduate Education subcommittees. Thank you for all that you're doing for the AAN. We appreciate it.
Yeah, no, I'm happy to be involved.
Yeah, Army of volunteers, lots of fun though, and good for career development for us educators. But the reason I'd really love to talk to you today, and kind of the focus of our talk, is leading during a crisis. COVID-19 has been, crazy, beyond crazy. And you have such a unique perspective. I'd love to try to just, as a gestalt, what has it been like these last few months for you?
Just really adaptive, right? Just kind of feeling where people are going, where the curriculums had to go. I mean, we basically had to convert the clerkship in the matter of a few weeks over to primarily being virtual. And now our medical students are clinically in person starting back on Monday, like finally in person. So kind of having to put all that together. We had to develop a brand new elective like in less than 2 weeks and roll it out. So it's just been a really a time of opportunity and just change.
So the key word there is adaptive. That's the summary word. And you've participated in leadership development programs. You've participated in programs and then tried to, I guess, apply the lessons learned. What are some of the most valuable lessons that you've learned in participating in the programs? And also, what have you learned from your experiences during this time?
So I think for the first question is really the leadership programs have taught me how to collaborate more and reach out and tap in really to the strengths of others, not just at my institution, but across the AAN and even outside the field of neurology. I mean, why reinvent the wheel, right? Why not collaborate, use what's out there and hopefully adapt it to make it, fit for what your needs are. And if anything, like this pandemic has just, I mentioned earlier, like just opened up new opportunities, like things that I had been wanting to do and waiting to do. Now some of those, those barriers that had been there were lowered. So it gave me an opportunity to kind of just roll some things out, which, was maybe difficult to do pre-COVID.
Yeah. Your primary focus, I guess, is on medical student education. So maybe we can talk about that. But I think, the ripple effects on education throughout neurology is profound, from graduate education, fellows that are graduating into a unclear job market, from, our annual meeting being shifted and, how we learn, how we educate, not just our students, but our members or, our practicing neurologists, APPs. What have you learned about the educational experience in a non-one-on-one in-person way? And are there some aspects that you think may be better? And do you think some of these aspects will continue, even when in-person teaching resumes?
Yeah, look, I know everyone's zoomed out, right? Everyone's like, oh, I'm going from one Zoom to the next. And I get it. And I certainly can, relate. But I feel like it's brought people in some ways kind of closer. So I think kind of managing that and for what it's done for me is like, now I know I can work from home. I actually have not stepped foot in my office or my clinical space since before March, actually.
Wow.
I haven't had to. I've been doing my clinic. I'm seeing my patients from home. I'm running the clerkship from home. I'm doing new electives from home.
Wow.
I just haven't had to. So for me, who was born and raised in Texas, right. I'm just like, maybe there's some other opportunities that I didn't even know were possible until now. It's just opened my eyes to like what's possible and how we can connect.
Wow. So when it comes to some of the patient care that I've done, I mean, there's a closeness because I see into their living room. you know, and we can talk about things like that. I walk to my office, and I live in a 500 square foot apartment with a 7-month-old, 2 dogs, a cat, my better half. It's like impossible to, like, you know, turn left and, you know, like we, you know, get in and out of like the minimal hallway into the kitchen, let alone like do video visits from there. So I just have been walking to my office. Really interesting perspective. I guess in some ways I could have stayed home more if I had more space. But I agree. When it comes to the students, I guess there's a closeness there too. Interesting.
Yeah, I think like for instance, when we start the clerkship, I mean, we started it, but it was all virtual, and we've been kind of in weaving in, you know, some education in terms of, you know, wellness. That's always kind of been there, but now giving them specific examples about like how to take care of yourself, knowing that people are doing more from home. Maybe their schedules are off. They're not getting the sunlight exposure, you know, and sleep is very important. So we're trying to give them some like tools that they could utilize real easily and even start today to help with their mental health and to help with their, you know, with their productivity on service and coming back on wards and interacting with patients and colleagues.
Right. How are the students doing from your perspective? How are they coping through the different, I guess I want to say it, I don't want to call it phases of the pandemic so far, because I still think we're probably in the, you know, the first phase of a very long protracted problem. But, you know, there's like the Kubler-Ross or whatever that term is about denial and anger, whatever those stages were, I'm forgetting now. How do you think the med students are kind of processing things, and where are they at now in terms of, you know, making it through?
Yeah, I think there's a lot of anxiety because it's unknown, right? You know, like there's been a shift with not only the clerkships and even changes in the amount of time they're spending on the clerkships, but with social distancing, the census, the services themselves have changed. There's a ton of anxiety related to like interview season coming and the match and how's that going to look and how are they going to be able to kind of stand apart when many of the clerkships have gone to pass-fail and some of the tests have been pass-fail now. But I also see that there's some more kind of flexibility and more empathy. And I feel like we relate a lot more. So I think the students are relating a lot more to their teachers and to the clerkship directors. So my sense is that they are, you know, more acceptable almost, you know, to kind of and kind of just know that there's going to be bumps in the road and even we don't know all the answers, but we're going to figure it out. So I think there's some optimism there as well.
That's great. When I've worked with students, just a handful really over the last couple of months, because things are so different now. But you know, even having students join via telemedicine, you know, we can do that through Zoom, and it's HIPAA compliant, and we've done that. You know, I'm observing resident clinic this afternoon, you know, through Zoom basically, which is very cool. And what I've noticed, I guess, how I've adapted during this time is before we start off anything, before we see a patient, anything, how are you doing? How's it going? And I guess, you know, we did that as physicians, I don't know, occasionally and sometimes, and maybe if someone looked tired or if someone, you know, if there's something seemed off or if you knew they were going through a hard time, but now it's standard. And it's just, it's really interesting. I think it's like, kind of like you said, it's brought the students and faculty closer a little bit, and it's kind of, you know, fostered empathy and compassion. And I guess it's something that I've learned to do basically now every single time.
Yeah, I think we as educators and naturally as physicians, we just need to check in not only with our patients, but with all of those around us. I mean, you know, we're all hearing that the suicide rates are higher. I think mental health is more of an issue. People are feeling siloed. They can't get out of their house. They're worried, or they may have known someone who has COVID or maybe even, you know, died from COVID. And there's just a tremendous amount of anxiety. And from the sleep perspective, I have patients that really never even were suffering from insomnia and now have it because they lost their job or they're worried they're going to lose their job. So it's just, and then with politics, just everything going on in the world right now, there's just a lot of stress and a lot of anxiety. And so I think the best we can do is just reach out and ask how people are doing, you know, whether it's our family members, our friends, but certainly people we work with and our students and our patients.
That's great. So actually, I'd love to transition a little bit to a non-education, maybe a little bit non-leadership topic, but a neurology topic, which we all know and love, and that's sleep. So I guess what I would say is I'm a cognitive guy. I'm an Alzheimer's person, and I've definitely seen changes, in people with, neurodegenerative problems and cognitive dysfunction, memory loss, definitely more neuropsychiatric complaints. Like you said, insomnia, maybe they had a little bit, now it's something different, waking up, more confusion. So I've seen that in my practice. But when it comes to maybe giving advice to a healthcare worker, a student, a resident who has been, maybe who aren't as adaptive or
Right.
resilient. Maybe we can, the term adaptation and being adaptive is so important, when it comes to, leading during a crisis. But there are some people that are built differently. They handle stress differently, and it affects their sleep. What are some general suggestions you make? Like as a cognitive guy, I think about what is the worst thing a person can do to affect, dementia risk and Alzheimer's progression. And one of the most things in neuropsychiatric terms is repetitive negative thinking. And I have patients that are like right before they're going to bed, they're just ruminating and worrying and just think, and then they don't get to sleep, and then they get to sleep later and they don't feel rested. What are some general suggestions that you would have?
Yeah, so I think one of my big messages is that timing is everything. Right. So most humans are set to go, based on our circadian rhythm, are set to go to bed at 11 p.m. and wake up at 7. That's the typical average person. Right. But especially right now with not only stress, but people not getting out of their house and whatever, like your circadian rhythm starts shifting. So then you start going to bed at different times, and hey, you don't have to wake up because you don't have to get ready necessarily for work and drive to work. So your awakening time becomes very variable. So I think one easy thing people can do is get a set bedtime and set awakening time. And you could start at 11 to 7, but if you couldn't do that, you can, deviate a little bit from there. But timing is everything. The other thing is looking at your environment, right? If you're one of these thinkers or worriers, like in your sleep environment, you shouldn't have, like a big stack of papers reminding you of everything you have to do, or if your room is dirty, your clothes on the floor. I mean, that never elevates anyone. Nowadays, we're encouraging people, not just patients, but people to keep like a gratitude journal, like at their nightstand. So at the, night, it should just become part of your bedtime routine, just like brushing your teeth is writing down like the 3 things that you're grateful for. So then you're always kind of in a positive mindset, like, despite everything going on in the world right now, you know what, I have my family, I have a job, I have a home, I have a dog, whatever those things are that you're grateful for. Because if you sit there at night, which a lot of people do, like you're saying, they're just kind of like, oh my God, I lost my job, or I'm going to lose it, or I'm worried about so-and-so. And that's not good for anybody. And that, in fact, can trigger or exacerbate insomnia, which is what we're dealing with at the moment.
Gotcha. Yep, that's totally helpful. Actually, this is something that I was gonna give this guy a shout out and thank you at some point during this video. But one of the medical students, gosh, he's not even in medical school yet. One of the college students, who then master's student and now became a research student, Nabil Saif, who worked with you for a couple of years, and then I stole him to Cornell. This guy has been like zooming, went from 0 to 60, over 10 publications in 2 years. I mean, like amazing, applying to med school now. He actually did a study, and he was the first author on a study, and then the first research coordinator I've ever had to be invited to write an editorial for a journal because of the research he's done in the field. Like, I don't know how that happened, but what we did in this study is actually used a wrist biosensor to monitor physiologic patterns, sleep and exercise patterns. And one of the, I'm going to say, crazy things I noticed, and I'm going to say crazy because I didn't understand, I'll just be frank, I didn't understand mind-body connection. I didn't understand, meditation and how it could actually have a biological effect, a physiological effect. I don't want to say I thought it was foo-foo. I just didn't understand. I was ignorant. Yeah. I was naive. But whether it's a gratitude journal, whether it's whatever way you do, transcendental meditation, we interviewed Bob Roth about this a week or so ago. The impact on a person's physiology is striking. We saw that the person's heart rate variability came up, which means the person is more, I guess, parasympathetically driven. We saw longer sleep times. We can see, better sleep patterns. These are wrist biosensors that are not perfectly accurate, so we have to, of course, take that. But, if someone can get more deep sleep when they're ruminating less, I mean, that's a win-win for everybody. It's a win for a neurodegenerative person like me, but it's also a win for overall health. Does the practice of gratitude and journaling and other practices, does it impact biomarkers like a cortisol or other things, or is that less clear?
I think it's less clear. There's a lot of variables when it comes to sleep and why people have difficulty sleeping. Like for instance, 80% of people that have apnea are not diagnosed. So there's just all these other factors that impact sleep. And, one of the things that I've been working with my partner, Charlene Gamaldo, who's another sleep neurologist, is like this idea of somnomics. Like when you look at precision medicine, right, as a way to provide personalized medicine, getting in front and treating the patient in front of you, there's all these omics, right? And I think when it comes to sleep is something that crosses all medical fields. Like we all do it, all humans need it. It's very important. And I almost think that somnomic, like that, the study of sleep, no matter what field you're in, is important to provide that personalized care. And so, I don't know. I think at the end of the day, it just encompasses everything, whether that's medical illness or mental health. It's so important, and we could all do a lot better.
Yeah, I couldn't agree with you more. And, in my practice for years, I asked how many hours a person slept, and that was it.
Yeah.
That was like way off, and again, we don't have the perfect trackers. Like I'm sure there's other much better ways to do it, but understanding sleep quality and the impact of stress, worry, lack of resilience, these can affect not just, in my field, cognitive outcomes, but across all medical fields. Advances aging, it makes probably blood pressure control. I mean, I'm sure every chronic illness is fast forwarded and worsened by impaired sleep. Yeah.
No, sleep is important. And I wanted to backtrack just real quick on Nav. He was one of our pre-docs, and I also want to give him a shout out because like our pre-doc program, it's like the students kind of come in, they're figuring out, do I want to go to med school? Do I want to be a pharmacist, a nurse? And he was just one of those people that I would meet with, and I knew he had it in him, and I have no doubt that he's going to do some fabulous things. But he was with our pre-doc program for several years, and I just had the opportunity to talk with him about a month ago. So I really thank you for being such a great mentor to him and helping him kind of get out of that, just kind of run and shine.
Yeah, well, hey, it's teamwork. You're a mentor. You put in time. You put in, efforts and mentorship. He came to me. This is a guy. I guess he had just finished his math. You saw him. I guess you met him as a college student. Mm-hmm. He then got his master's degree in biophysics. I think at George Washington or Georgetown or something. I'm sorry, I'm forgetting. And then he comes to me with, tremendously well mentored, and then we just kind of continue to mold. And I don't want to sound cheeky or silly, but he grew like a sunflower before. He's a leader. He's a clinical leader. He's a research leader. He's adaptive. Great word that you used. I wrote his recommendation for medical school, and I wrote, in baseball terms, he's like a utility player, meaning he can play the infield, he can play the outfield, he can, pitch, he can do whatever else. So I think one of the beauties across medical education is, we like to see the people we mentor succeed, and putting in that time, he absolutely exceeded all of my expectations. Aside from the MCAT scores and the Johns Hopkins he's got the pedigree, but it becomes much more than that. He was a doer, and I think honestly, without mentorship, I don't think he would have done that. So it's a shout out to the medical educators out there that occasionally were successful.
Yeah.
Did a lot of hard work anyway. Well, Rachel, thank you so much. I really enjoyed this. The COVID pandemic has been challenging, to say the least. It will continue to be, to shape our field for years to come and decades to come, shape our medical education for decades to come. But thanks to adaptation and thanks to, some leadership skills, I hope that our field, from clerkship directors, program directors, department administrators, we can shine in this difficult time.
Yeah, definitely. Well, thanks for having me. It was fantastic. And thanks for all doing all this. I mean, and, spreading the word and getting people to share their work.
Absolutely. Yeah. I'm no Anderson Cooper, but I'm trying.
Not yet.
I'm taking notes. Babies. Well, watch out, AC.
Yeah.
All right. Here I come. Pleasure. Enjoy the chat.
All right.
Take care.
Take
Bye-bye.
care.